All right, listen, over 1 million Canadians are affected by heart valve disease, but awareness of the signs and symptoms, it is shockingly low. So this week is Heart Valve Disease Awareness Week. Here with more on his special connection to the cause is heart valve disease survivor Cole Moro.
Hi.
How are you?
Good.
You have a very interesting story. So let's get, first off, what is heart valve disease? Let's start with that.
So you have 4 heart valves, and the heart valves are very important structures within your heart to prevent the reflux of blood and keep blood moving forward. So if you have incompetent valves, the blood can reflux and it won't be going forward in your heart, and your blood pressure can be affected, and it can also impair the ability of blood to go even move forward because it can really put a lot of strain on your heart.
But if you have this, you can live a daily life. You can live a normal life.
And that's the thing. It's really it can present as asymptomatic up until it's severe disease, and so it's why it's so important to get an evaluation by a primary care provider to get a stethoscope check, and then just before you can have severe symptoms.
Okay, let's get into your story, because you were practicing to become a physician assistant.
Correct. Yeah.
In class, somebody had to put a stethoscope on yourself.
Yeah.
And said what?
They said that I had a murmur, but at the time they were like, this doesn't really check out. You're probably just really athletic. And so this was just.
And you're just like, yeah.
I was like, yeah, probably. Yeah. And then it just continued on. And then when my wife and I moved to Hamilton to work in the COVID ICU at Hamilton General and the Juravinsky, that's when we switched family doctors, and I took my blood pressure just as kind of an introduction to the clinic, and my diastolic, which is the lower number, was like 20, and a normal is about 80. So like really my blood pressure was dropping immensely right after my heart was beating, which is indicative of aortic valve failure.
So then what happened?
Things got to move pretty quickly after that. I saw a cardiovascular surgeon pretty quickly, and my surgery was scheduled.
And what was it like going through surgery? This is a massive surgery. This is open heart surgery.
So I think that the worst part obviously was leading up to the procedure, because it is your chest getting sawed open, like them stopping your heart to do an operation. So that was really, really awful kind of leading up to it. But I mean, after the surgery, it could deal with pain.
Nice dance moves. Feeling pretty good?
Yeah. It was, after the surgery, it wasn't too bad. I had a lot of support from my family and my wife.
And then clean bill of health. A-okay.
Yeah. I had my ultrasound of my heart recently. It showed that my heart had completely remodeled. I have a mechanical valve now, so I have to take a blood thinner. But yeah.
You want to check me out?
Yeah,
quickly?
let's do
that. We only got a minute, but this is key, right? Just having a family doctor and just going to get checked out.
Yeah. So just breathe normally. Sounds good.
Yeah?
Yeah, sounds good.
So
I wouldn't lie.
Yeah. I don't know.
Yeah, I know.
But that's how easy, that's just going to your doctor and just getting checked up. Because a lot of time, even if you have a doctor, you just might not be going to get checked up because you feel that you're in good physical health.
Yeah, and I mean, this is the first line of defense in figuring out if you have heart valve disease. And then, I mean, to figure out more information on the signs and symptoms and resources for heart valve disease, there's the Heart Valve Voice Canada website, which provides a lot of information.
Amazing. Thanks for sharing.
Yeah, thanks for having me.
Thanks for checking me up.
Anytime.
Okay, good stuff. Cole Moro, heart valve disease survivor on Morning Live.